Do you often feel like your child is coughing more than usual, especially during cold weather? Or maybe they sound a bit wheezy, like a tiny whistle when breathing. If yes, it could be something called Respiratory Syncytial Virus, or RSV. RSV is a very common virus that affects the lungs and breathing passages. Almost all kids get it by age 2. It usually feels like a bad cold, but for babies, older adults, or people with weak bodies, it can get serious. Think of it like a cold that sometimes turns into a bigger problem, especially in tiny lungs that are still growing. So what causes RSV? It is caused by a tiny germ called a virus, specifically the Respiratory Syncytial Virus. You can't see it, but it spreads super easily. Imagine your friend sneezes, and tiny drops fly into the air. You breathe them in, boom, you might catch RSV. Or maybe you touch a toy they coughed on, then rub your nose. Same result. It's like invisible cooties that move fast during winter. Only humans get RSV, and once you've had it, you can get it again. Your body doesn't remember it perfectly. That's why you might get it more than once in life. What should you look for? Let's play detective. If a baby is breathing fast, like more than 60 breaths a minute, or flaring their nostrils while breathing, that's a clue. You might hear a whistling sound, called wheezing, or see their chest sucking in with each breath. We call that chest retractions. Older kids or adults might just have a runny nose, cough, or low fever like a cold. But here's the red flag. If a baby is not eating well, acting very sleepy, or their lips turn blue, that's when you need help fast. Think of it like a car engine sputtering. When the body can't get enough air, it's serious. How do doctors know it's RSV? They might swab your nose, just a quick wiggle inside, to test for the virus. It's fast and simple. Most of the time, treatment is about helping the body rest and fight the virus on its own. No antibiotics work because it's a virus, not bacteria. For mild cases, lots of fluids, rest, and a humidifier help, like giving your lungs a gentle steam bath. For serious cases, especially in babies, they might go to the hospital to get oxygen or IV fluids. It's like giving the body extra help while it fixes itself. There's no magic cure, but doctors know how to support you until you get better. Can you stop it before it starts? Yes, good habits make a big difference. Washing hands often is super important, like after playing with toys or before eating. Use soap and water for 20 seconds. Sing happy birthday twice while washing. That's how long it should take. Keep babies away from people who are coughing or sick. And if possible, avoid crowded places in winter. For high-risk babies, like those born early or with heart or lung issues, doctors can give a monthly shot during RSV season to help protect them. Think of it like a tiny shield to guard their lungs. Good news, science is moving fast. In 2023, a new RSV vaccine was approved for older adults 60 and above. It's like training the body to recognize the virus before it attacks. Another vaccine for pregnant women helps protect babies right after birth, like giving them armor from day one. Scientists are also working on long-lasting shots for everyone. There's even a new treatment called monoclonal antibodies that help high-risk kids. It's like sending in superhero antibodies to block the virus before it causes trouble. These advances can save lives, especially for fragile lungs.